Let's talk about the diabetes as it progresses and what we can do for it.
So, we talked a little bit about the non-proliferative with the little macular edema and that sort of thing. So the next step, and we briefly touched on this, is something called proliferative retinopathy. And that's where the new little blood vessels start to grow, and they can break and bleed and fill up the eye with blood, and actually sometimes cause enough scarring that the retinal will detach. It can also form something called neovascular glaucoma, which is a particularly nasty, very difficult type of glaucoma to treat.
Do you see these changes much, this proliferative part? Where
Unfortunately.
Yeah. And are there things that we can do for that?
So there is. So I mentioned that there are some injections. So there are sometimes the injections are starting to happen a little bit more for the proliferative, but the laser treatment is still, I think, the gold standard for proliferative retinopathy. But what we do with that is people will get hundreds and hundreds of laser shots in the peripheral retina.
Do you have to shoot the laser beam 100 times?
Oh,
or can you scatter it out? Or do you have to go at each individual little dot?
Each dot is a different shot, and there'll be hundreds of shots. And so, but what that does, remember I mentioned earlier to you about the retina that was kind of dying off?
Yes.
And so you're basically taking that retina, killing some retinal cells that are already almost dead, so that the signal for those new little blood vessels is removed, and that will help get rid of those new little blood vessels.
So the eye, the vision that was being destroyed, can come back toward normal?
So what you're doing is you're killing off some retina in the periphery in order to save the vision in the center.
It seems like it has to be very, very, very meticulous and very, very knowledgeable to go in and attack the right areas of this.
Oh, absolutely.